Former government chief scientific advisor, and he now chairs the Independent SAGE, and he joins me now. Good afternoon to you, Sir David. Thank you so much for joining us. What do you think about where we are? The government about to announce a new national lockdown in England. Is this something that could have been avoided?
No, I think for various reasons this lockdown is absolutely critically necessary, although we all have to say that a lockdown is a very blunt instrument. But we're left with no other instrument in our hands, and I'm afraid we have to go into a lockdown again. But let me very quickly say, this is what Independent SAGE have been saying, it's what SAGE has been saying for over a month. And if we'd gone into a lockdown earlier, it would have been much easier to bring the number of cases down rapidly, and that would have had much less impact on the economy and also, of course, on the death rate.
And yet the government, of course, has to balance health and economy and people's own feelings about the liberty that they should be allowed, and it has to take all of these things into account.
There is a false dichotomy between economy and health and number of deaths. Those countries that acted quickly in the first place, such as Greece and Germany and Southeast Asia and China, have had the lowest impact on their economies and the lowest impact on the number of deaths. It's very simple. If you allow the disease to spread, as we've now done for a second time, then the number of cases in the country just goes going upwards at an exponential rate. That it means it's doubling over a certain period. And at the moment, our disease rate is doubling every 2 weeks. If we had acted 4 weeks ago, we would have had substantially less cases per day and substantially less deaths. But nevertheless, very much to be welcomed that we go into a lockdown now. And then what we need to be sure of, and this is what you've just heard from Debbie Sridhar, is that we need to make sure that we have a fully functional, for the first time, a fully functional test, trace, isolate and support system in place. Because that is the only way we have to get to an end strategy. This is a very sophisticated instrument. Test, trace, isolate and support means that you're isolating all the people who have the disease from the rest of the population. And when you do that, the rest of us can go about our normal business, good for our health, good for our economy. So we have been faced with this really silly false dichotomy for a long time. And I just want to hammer that. But here we go. If we do follow what we are hearing, then this lockdown is going to be with schools open. And our calculation on Independent SAGE is that with schools open, it would take something like 5 to 6 weeks to bring the number of cases in the country down to 5,000, which is roughly where we were in July this year. And at that point, we should be able to have a test, trace, isolate and support system in place. But we won't get it in place unless the government announces tonight what it is doing to create a much better test and trace and isolate system. So I think for me, that's a priority. Otherwise, we will simply go from one lockdown to the next without managing to shift across to this much more sophisticated instrument. I've even heard people arguing that it's the older people and the people who are at risk from dying if they get COVID-19 who ought to separate. Now, this is simply putting the whole thing the wrong way around. And by the way, that's an impossible objective because many, many of us who are a bit older are living close by with children, younger people, and so on. So separate out. But let me stress the support side of test, trace, and isolate and support. Quite absolutely necessary to see that a really high level of people who've got the disease, but also who've been in contact with people with the disease, are fully isolated. And that's not going to happen unless we provide a support system with finance, with possible alternative accommodation. We need, for example, to requisition hotels to do that. All of this needs to be put in place by government. And I think as well, and this is critically important, we need to hand it over to local directors of public health to operate the whole system. We need to engage local people such as GPs and the 44 molecular virology labs in the test and trace system. So as we move forward, let's see that the lead on test, trace, isolate and support is given over to NHS England and taken away from the companies that have so far not been able to deliver, and then see that we engage top-tier local authorities and, of course, GPs.
You're a former chief scientific advisor. You've set up this independent SAGE, this alternative to SAGE, if you like. Have you had any contact with government? Have you managed to speak to them about what you say?
No, we put our reports into government, and no, we don't actually speak to them, except that, of course, every Friday we have a public meeting. A very large number of people now regularly attend our Friday meetings, and we're very happy to speak to anyone in government, but really the door has to be opened at both ends for that discussion to take place.
Okay.
But you know that SAGE and independent SAGE over the last 4 to 5 weeks have been singing from the same hymn sheet. In other words, there is really a good correlation between our position today and the position that SAGE is holding. And as I said earlier on, if we had gone into a lockdown 4 or 5 weeks ago, when we should have, and by the way, there's no surprise about where we are now. I'm not going to agree with the comment that it all looks a lot worse than it looked a month ago. We were predicting very, very precisely where we are today, and I'm afraid we're very confident in our predictions, for example, on death rates, because while we've got today 360 new deaths being reported, what we are sure of is that in 2 weeks' time, that figure is going to be more like twice that. And that's because the deaths follow what happened weeks ago and not today in terms of the number of new cases.
OK. Thank you very much indeed. That's Sir David King. Thank you very much for your time.
Thank you, Rita.